Assalamu alaikum. Welcome to the North American Muslim Foundation Senior Talk Show funded by the New Horizons for Seniors program. On this episode, we have Dr. Yasmeen Siddiqui. Let's hear the needs for the community through Dr. Yasmeen Siddiqui. Let's welcome Dr. Yasmeen Siddiqui. Welcome to the Seniors Talk Show by the North American Muslim Foundation of Toronto.
Thank you very much for inviting me.
Yeah. How are you doing today?
Very good,
Yeah.
Alhamdulillah.
I'm glad you're here, Dr. Yasmeen. Today's talk show, we will be identifying the needs of the seniors, and as a family physician, we would like to hear some suggestions from you on social isolation for seniors and other important, services that they would be requiring from the medical health care. And I'm sure you have been into practice for so many years. We will hear it from you. And what's the best that we can improvise within our medical system?
That is a very good topic. I think the public need to know all these things.
Yes. So would you like to share a little light on your immigration?
My immigration, I came a long time ago in 1973. I came here with my certificates and with my books, and believe it or not, only $7 in my hand.
$7.
S-E-V-E-N.
Good enough for Tim Hortons for today.
Yes, only $7 in my hand. What I am today is all from the Canadian government and the blessings of the Lord that I'm here, and I had a very, very successful life. I have practiced medicine for 35 years, and now I'm retired, and I am fashion and very much willing to give it back to the Canadian people, what I have got it from here in the last 50 years or so.
As a family physician, I'm sure you must have come across many cases, many challenges, those challenges that you must have identified 30 years ago, and current challenges that you might be noticing in the community. Would you like to share a little bit about that with the viewers?
Yes, when I first came, there were very few female physicians. So when I was interning in Halifax, Nova Scotia, many people used to think that I'm only a nurse. And they used to tell me that I want to see a real doctor. And I used to say, I'm the only doctor here. So it was hard for the public to know that the female physicians can be here in Canada too. But now there's so many female physicians and so many specialists, like in orthopedics and in neurosurgeons, a lot of female physicians say. So there's a big change that has come. The health system in 1970s was good, but now it is different. Just because the population is growing demographically, there's more and more seniors, and it is challenging because there's more and more new diseases for seniors, like there's more dementia, more diabetes, more complicated cases of kidney failures, we call it renal failure. And Alzheimer's, etc. So the challenges are more, so the medical system has to change accordingly over several decades to meet the needs of the community.
So what are the topmost challenges that the seniors might be facing with the medical system, and what is the certain solutions that you can probably advise us on?
Yeah, I can give you some challenges and their solution. First of all, the seniors are, I would say that not only just that population is increasing, but also the diseases are different, and also the treatment has changed. So from all around, you have to impact it in a different way. Now, I can say about seniors who are staying home with their families, and the seniors who are in senior homes, retirement homes, or nursing home.
Or long-term care
care as well. So there's two different categories. So if you look at the seniors who are staying home, the challenge is slightly different, but still it needs some improvement. So first of all, I would say that because the population has increased, because of the diseases have increased, the nursing homes are full. And there's a long waiting list. So many families are forced to keep their seniors with them, even though the couples are working, the parents are being left alone in the house. So that is a big challenge. So we need to have, if the nursing homes are full, and the seniors cannot get in, then what we need is we provide help to these families who are keeping their parents home.
Yes.
And most of the parents, they know English, they can navigate through it easily. But some parents, they have come to join their families. So they have come from countries who don't speak English well. So they are coming with a different attitude and different environment and their
different culture. Different approach and different culture.
So for them it is harder. So the Canadian government has to do something to accommodate them. So the way we can help the working people who are keeping their parents home is to provide more home care services, personal support worker, so that they are easily looked after at home. And it's cheaper to have the seniors staying home rather than in the nursing home.
Yeah. So how many hours of personal support does a senior receive in a day?
Okay, that is a big question. Let me just tell you, it depends upon the needs of the senior. If the senior is mobile, they are able to go in and out of the house and whatnot, they need less care. But if they are confined to home, they cannot go out and any transportation or anything, their care is different. But if they are bedridden, the care is different. So it can vary anywhere, to be specific in a general way. It can be once a week, to every day, to 2 times a day, to even 3 times a day.
Okay.
So it can vary depending upon how crippled the senior is at home. So that's one thing. Then for these seniors who are mobile, we need drop-in care. So they should have a center in which seniors can drop in to chit-chat, have coffee, do some activities, exchange their views, and then tell what complaints they have about their family members who are looking after them.
And socialize too.
Yeah. So that way they can ventilate their feelings and they see how other seniors are handling it, and it will be easy to handle them. The other thing is we need a proper dental care for them, because the dental care, we have special care for children, you know, what do they call, smile. Children, what do they call? Healthy smiles for children. We have special for ODSP, we have special for those who are in foster home, but the care they have, dental care they have for seniors who are home is not optimal. And dental hygiene is very important because it can prevent many diseases.
Yes.
You know, nowadays it's very common for them to have gum diseases. And cavities.
Lead to mental health too.
Yeah,
Oral
cavities
health can lead to mental health.
Mental health, and also, you know, digestive health system. So they have to have some proper care for their dental checkups. And another thing I want to point out is some of the companies, I don't know whether government can do something about it or not, some of the companies, they discontinue the dental care the minute the person retires. So when you are working, you have dental care.
But after retirement, you don't. That's when you need it the most.
And you have the time to get it more.
Yes.
So, but that becomes an issue. So these are the issue for those who are staying home. And the most important thing that bothers me is we have to detect senior abuse. Because some of the seniors are abused, because the seniors get certain money. So some of the families are keeping the money and not utilizing that money to use on them.
Yes.
So some of the, about 5 years ago, there was something in news that one of the senior was kept in the garage for a long time, something like that. So we have to have some system to find out senior abuse and detect it, and also they should have a number, just like we have 911, 311.
It's like tracking, just a tracking number to see if the senior is doing well, and a number for the seniors to contact if they have any complaints.
So they have something they can call and say that, hey, I'm not being looked after here, so help can be reached. So we have to have, so this is only for those who are staying home. But those who are in nursing home or retirement homes or, you know, seniors home, for them it is different. For them, what they need is, before they used to have a system called community care services. And that was good because they used to have, you know, healthy eating program, bone health, how to navigate through the system, and how to detect the signs of heart attack, how to detect the signs of stroke, and all those things. That is taken away. And now they have what is called LIN, Integrated
Local Health Integrated
Network. And with that, it is good in a way, but some of the things are falling apart. So we have to have good PSWs, and we have to have a good pay scale for the PSW, so that they go and provide the service. Because PSW is doing a lot of work. It is hard work, you know, to go and lift the seniors, to go and change them, to change their diapers, you know, and give them a bath. And they should be paid accordingly.
They should be paid well. And you know, there's a certain respect for that job. There's a certain respect for the job. And once they are paid well, then you will find many PSWs coming into this profession.
And they don't get a full-time job. So many PSWs who are working part-time here, part-time there, and that was the reason why COVID-19 is spread that fast, because these were taking from one senior home to another senior home. And this PSW should not be run by private sector, it should be run by government sector. And there should be proper pay scale. Because otherwise they will be changing them, and many PSW work for some time, and then because of their back hurts, they stop. And then you're looking for new ones. They're looking, and it is not good for some seniors who have Alzheimer's or mental, because they get used to one phase, then all of a sudden a new phase comes up.
You know, I heard about that because there were some friends that I was talking to, and they have their mother-in-laws, you know, who are taking care of PSWs, and they said, we like this PSW and we are very uncomfortable with the other PSW, because this is human nature. This is human nature. I would like a style of a PSW, and I may not like the working style or attitude of another PSW. So I agree with you. If that PSW is given some additional hours, then the patient is taken better care of, and the PSW can save time traveling. Imagine the amount of time that the PSW is spending commuting from one patient to another just for 1 hour of service. Right.
It is a lot for them. So maybe they can do something about that. So we cover all the seniors who are home, and we cover all the seniors who are in the nursing home. And that would be good. And it's not easy to do it, but something they could start thinking about.
We can start small. We can start small, and that's how changes always take place, right? You start small, and when things are working, then automatically you're providing more services to more seniors. Now that's a wonderful feedback that you have shared with us, Dr. Yasmeen. And as you know, we have all been suffering from this pandemic for the past 1.5 years. What would you suggest for people who have been affected by COVID-19, and how have you been dealing with this situation?
COVID-19 actually did not affect me much. It's a blessing for me, because I kept myself busy, and I was much busier, and I didn't know where 2019, 20 went, and even 21 is in August now. So the time has gone very fast for me. But those who really didn't know what to do, it was a struggle for them. They suffered from social isolation, they suffered from lack of income, they suffered from not able to see their friends, families, etc. For me, it was just not able to travel, which was okay. But for others, it was much more. And because they were struggling to get the food on the table, struggling to keep abreast of what is happening, especially if the children are home, and the seniors were somewhat more neglected, because those who are home, their family has to look after their children along with them. So everybody was home. The seniors were home, the children were home, the jobs were getting done from home. So it was hard. It was hard. But for me, it was okay.
So as a professional, as a service provider, how would you address social isolation for seniors? And again, how would you advise them to avoid social isolation?
Okay. Social isolation and physical isolation, those are the two things we have to see. Public health measures from WHO, World Health Organization, they said physical isolation. They didn't say social isolation. So there's a difference between the two. You are supposed to stay away from each other, keep the distance, physical distance, but socializing is not an issue, because socializing doesn't mean you have to sit together to socialize. You could socialize over the phone. You could do like video calls, or you could do WhatsApp calls, so you could do FaceTime, you could do Zoom meetings, anything like that, like a virtual meeting. And you could stay connected not only with your friends and family, families, distant relatives, and even the people. You have more time now to dig out who are the people you have not called them for a long time.
Yes.
You know, your friends from school, friends from college, friends from your neighborhood. You could call them and talk to them and then chat and, you know, talk about what the past experiences they had together, and they can still be happy. But the thing is that the senior has to know how to use a mobile phone, how to make a phone call. When you know that, or the family who is sitting with them can help them out, then it will be good. So those seniors who are educated, that's okay. But the seniors who are not educated enough, for them it's a problem.
That's a problem, yes. It's really good that most of the grandchildren are teaching the grandparents, technology. So I see that the seniors who were unable to use the mobiles now during the pandemic, I have seen them coming on WhatsApp. I've seen them chatting on WhatsApp and sending videos, sharing videos to each other. So, you know, they are trying their best. They are trying their best to keep up with the times. So which is really good, really good. Our next question to you would be, how can our senior balance their physical and mental health? What advice would you give? And what are the gaps you would say you have identified within a senior maintaining his physical balance and a mental balance?
See, for physical balance and mental balance, it's very important that you look at the whole well-being of a person. So I would say that you know, balanced nutrition, you know, healthy eating habits, and adequate exercise and proper sleep. Those are three most important elements for the well-being. And if you keep track of those three things, you won't go wrong. Physical exercise doesn't mean that you have to go jumping jacks 30 times, 3 times a day. It means even simple walking, simple stretching, and anything, gardening, light things, you know, watering the plants, anything simple like that you could keep up with. And for mental health, you have to have some spirituality, and you have to have a positive outlook for life. Always think of being thankful for what you have, grateful for what you have. Look at the things that you have and concentrate and be happy with that, rather than look at the things that you don't have. And then think about that and worry. Have a positive outlook for life. Enjoy every minute of your life. You spend all the time in raising your children and you know, making money and looking after yourself and all that. But now it's time for you to look after yourself when you retire and as a senior. But I find many of the seniors, including sometimes me, it's a lesson for me too, rather than doing that, they spend more time with their grandkids and they're still looking after their children. And so this is never going to end till your last day. So you have to think and stop and then look after yourself. Enjoy every moment of your life, and stop blaming others or you know, making excuses. Oh, I can't do it because my daughter is working, because my daughter-in-law is working. So stop making excuses. Just look after yourself, because you deserve to look after yourself. It's more important. Whatever money you have earned and saved, you spend on yourself and enjoy your life. So other than that, for spirituality is very important. Be connected with people who are positive minded. Be connected with people who give you positive energy. Be connected with people who will make you feel good. Go to groups where there is senior activities, where there is senior exercises, where people sit down and play cards, whatever they do. And you know, program like your program, you know, they join. The minute they retire, they have to make up a schedule and say, I'm going to do this, upgrade themselves. You know, the way they can upgrade themselves is whatever they wanted to do all their life, they can't do it now anymore. So now it's time to do it, because you never did it before. Whether it's painting, coloring, or you know, arts, any of the thing, teaching, anything you wanted to do, you could do it and upgrade yourself. Because many people, if they're not educated, they say, oh, I didn't do all my life, what am I going to do now? But you are going to live another 20, 30 years. So you have to do something.
Now that makes a lot of sense, because what I have noticed is, as you know, I've been delivering programs in the community, developing programs for seniors within the community, and I've been in this field for almost 18 to 20 years now. And the difference I found is, before, people were hesitant to come to programs. They would say, oh, what are we going to do? Just come and socialize and chit chat, and what after that? So they did not think that socializing was an important part of their life.
Yeah.
But now down the road, I see that as soon as they are retiring, or some of them that I meet who haven't retired yet and who know about the program, they come and tell me that, I can't wait to retire. Because these programs are keeping seniors healthy.
Yeah.
These programs are keeping seniors active. And now their children, their daughter-in-law, son-in-law, they drop their parents, mother-in-laws to the program, and they pick them up happily, saying that, they are excited to join the program.
Oh,
so if the New Horizons Seniors Program officials are listening to this, yes, there's a tremendous improvement with the seniors within the community joining these programs. So please try to continue funding them on a regular basis so we can keep all the seniors healthy.
Yeah, I can add to that. You had programs even during COVID season.
Yes.
Like you're meeting in certain
on
Zoom, and then you're meeting in the playgrounds, parks,
Yeah.
and that was good because people were looking forward to come and
Yes.
join that. Yeah.
Yes. Yeah, we're
that's-
still continuing programs in the park so they can maintain their social distancing and at the same time physical distancing, like what you explained just
Yeah.
now, and then still be part of a group.
Yes.
And they are really looking forward to that time to come outside, and the parks will be utilized much more in the upcoming months and years till everything gets back to a normal situation.
Yeah, that's a good.
So this is wonderful talking to you, Dr. Yasmeen. We learned a lot about the gaps in the services and how we can help each other, and how even the medical system can improve because of the growing population of the seniors within the community and the country itself. Any other suggestion you would like to give as we wind up for our seniors and our viewers?
I would say that it's a blessing that you are a senior. Many people die early.
Yeah.
So take that blessing and utilize your time and be active in the community and give something to the community, because what you are today is what the community gave you. So you should give it back to the community.
Thank you, Dr. Yasmeen. It was such a pleasure having you on this program, and it's a pleasure learning more and more about our healthcare system, about our seniors, and let's help each other. And we hope we have an enriching community that we can let the government officials be happy about their services that they're providing, and we contact them again for needs to be fulfilled for the seniors. Thank you once again.
No problem. My pleasure. Anytime.
Thank you. Thank you, viewers. Once again, this was the Seniors Talk Show on behalf of the North American Muslim Foundation, funded by the New Horizons for Seniors program. Stay tuned for our next guest in our next episode. Your host, Sajida Khan.